Hi everyone, my name is Lucy and I'm going to be covering a rare genetic disorder called hemophilia. Those born with hemophilia bleed excessively because they have an inability to coagulate blood when an injury occurs to the blood vessel. Symptoms of this disease are nosebleeds, heavy bleeding, even from a minor cut, hematuria, and bloody stools such as melanas and hematochezia. Large hematomas are found all over the body, bleeding in the joints, which can cause the joint to swell up severely with blood, damage the joint, and cause pain. Brain hemorrhages and hematomas are the most dangerous complication because even a minor bump can cause death, as well as seizures, painful headaches, emesis, dizziness, sudden weakness, double vision, and mood swings. Hemophilia results from a missing or deficient protein needed for blood clotting. The two main forms are hemophilia A, which has factor VIII deficiency, and hemophilia B, which has factor IX deficiency. Hemophilia A is much more common in the population. There are 4 times as many cases of hemophilia A than hemophilia B. According to the CDC, hemophilia is a rare disorder that occurs in about 1 in 5,000 male births. In the US, there are approximately 20,000 people that suffer from this disease, while the world population is found to be over 400,000. Approximately 75% of those individuals still receive inadequate treatment or have access to no treatment. To form a blood clot, our body initiates a clotting cascade. In this diagram, the cascade has 2 pathways, the intrinsic and extrinsic pathway, that converge to one common pathway. The intrinsic pathway is activated by damage directly to the blood vessel. The extrinsic pathway is activated by direct damage as well, but also through damaged tissue outside of the blood vessel, hypoxia, sepsis, and inflammation. When the blood vessel is damaged and exposed to collagen found in our tissues, it attracts platelets to form a loose platelet plug. However, this is a temporary measure. The clotting cascade is then activated in the hopes of strengthening the plug by forming the clot, which is known as a thrombus. The goal of the pathway is to convert fibrinogen, a soluble protein found in our blood, to insoluble strands of fibrin. This forms a fibrin mesh that stabilizes the platelet plug. In both forms of hemophilia, the complete lack or deficiency of factor VIII or IX cannot activate the next step necessary in the cascade. Therefore, a weak clot is formed, or no clot at all. This disease is a genetic disorder that is inherited, and it is X-linked recessive. Just to review, females are born with 2 X chromosomes, one from mom and dad. Males inherit an X chromosome from mom and a Y chromosome from dad. For women, the disease has to be homozygous for the trait to manifest phenotypically. Homozygosity for the trait means that both X chromosomes have the alleles for hemophilia. In women, if you only have it on one X chromosome, you are heterozygous. The disease will not manifest because the other normal or dominant X chromosome will mask the trait. In this case, that woman is a carrier for hemophilia. For males, because the X chromosome carries a gene for hemophilia, it only takes one defective gene for the disease to manifest. That is why the disease is more common to see among males at a frequency of 1 in 10,000 births, and rare in females, about 1 in 100 million. Unfortunately, there is no cure for this disease. Since hemophiliacs do not have factor VIII or IX, the best way to treat the disease is to introduce the missing protein into the bloodstream. This method is known as replacement therapy and can be derived from the human plasma of donated blood. However, this method was not always foolproof, as seen in the 80s. Reported by the CDC, hundreds of hemophiliacs all of a sudden were found to have symptoms of AIDS. The blood supply was tainted and thousands of people died. Because of that epidemic, there are processes that help ensure the factors are now safe for injection. Donor blood is now screened for viruses. The human-derived plasma is also sterilized by heating the product in order to kill viruses without destroying the factors in them. Or it is made through recombinant DNA techniques, which use hamster cells as a vector with the factor genes modified in them to just make the proteins. Desmopressin, or DDAVP, can also be used only to treat mild cases of hemophilia A. DDAVP is a man-made hormone that stimulates the release of stored factor VIII in the liver, which increase the level of the factor protein in the blood. This drug is administered by injection or as a nasal spray. Because the effect of the medicine wears off, it isn't often used, so it is given in certain situations. For example, you may take DDAVP prior to dental work, or before playing certain sports to prevent or reduce bleeding. Antifibrinolytic medicines like tranexamic acid may be used with replacement therapy. They're usually given as a pill, and they help keep blood clots from breaking down. This ensures that you are making the thrombus as well as keeping it stable for a longer period of time. Thank you for listening, and I hope you found the presentation interesting.